Hello, this is Dr. Anil Sharma. I'm your eye surgeon. Today, you have come to see me for your cataracts. This video will give you an insight on what cataract is, its management, and associated risks. The lens of your eye is normally transparent. If it becomes cloudy, making it hazy to see, it is then called a cataract. The common causes of cataract are aging, injury, medications, and radiation. The symptoms are blurred vision, difficulty in reading, reduced contrast sensitivity, sensitivity to light, glare, problem reading road signs, and unable to maintain driver's license. Cataracts can be removed surgically. In early stages, glasses may be of some help. The cataractous lens is extracted and is replaced with a permanent artificial intraocular prosthesis, an optical device. A week or two before surgery, you have a preoperative assessment done where you will get measurements and scans carried out to determine the correct treatment plan for your eyes. The power of the intraocular lens is determined with theoretical mathematical formulae using sophisticated device. I then select the optimal intraocular lens power in order to best correct your vision as per your vision demand. The selection of these lenses largely depends on the anatomy of your eye, your vision requirement, occupation, and your hobbies. Intraocular lens calculations are done by computers using different data and formulae. It is therefore a compromise. Due to several reasons like wound healing, final placement of the implant, the anatomy of your eyes, most people will need to wear glasses, especially for reading. There are several intraocular lens options depending on the anatomy of your eye and visual demand. Monofocal intraocular lenses is a single focal lens that corrects vision either for distance or for near. Most people opt for distant correction and are happy with reading glasses. Some people ask for monovision correcting one eye for distance and one eye for near. These days, multifocal intraocular lenses are also available. They help correction of distance, intermediate and near vision. There is, however, a compromise with this type of lens as it limits the amount of light entering your eye as a result of light segregation through distance, intermediate and near portion of the implant. The implant thereby may cause night glare or halos, double vision, ghosting images, and impaired depth perception. Some people also have coexisting astigmatism. Intraocular lenses that correct astigmatism is called toric implants. It corrects astigmatism that is caused by irregularly shaped cornea. Although toric intraocular lens reduces most of the corneal astigmatism, small amounts of astigmatism may be left uncorrected, which may demand further glasses for the same. Multifocal and toric lenses are premium lenses and they cost you more. Cataract surgery is mostly done under local anesthetics and sedation, while some need general anesthesia if indicated. Your anesthetist will sedate you and then inject a local anesthesia around your eye so that you don't feel during the surgery. With the injection, you might get a bruise or some subconjunctival bleed, which is usually resolved in a week or two. Next, a nurse will clean your eyes with antiseptic and cover your body and face with a drape, leaving an opening to your eyes to be operated upon. I use a phacoemulsification surgery technique to break the cataract and extract it, and then replace that with an intraocular lens, ensuring a proper alignment has been done. After the operation, you will have your eyes patched, which is usually taken off on the same day, about 5 hours later. You are then expected to start 2 lots of drops to continue for a month. You are seen by me a day after surgery to ensure the surgery has gone well. On that day, I might prescribe you extra medications if necessary. If you have bilateral cataracts, each eye is done at least 2 weeks apart. Further follow-up visits may be required, which I will let you know. Otherwise, if everything goes well, you see your optometrist in 1 month after last surgery for a final checkup, making sure the eye is all settled and quiet, intraocular pressures are back to normal, and glasses can then be dispensed. Cataract surgery involves an alteration of the focusing power of your eye, and hence your status of glasses may change postoperatively. For instance, someone who has cataracts and are able to read without glasses before surgery may end up needing reading glasses afterwards. It should be noted that the goal of cataract surgery is to offer good vision with or without glasses. If substantial residual refraction error results, it can be treated with additional surgery, which involves inserting a second intraocular lens called a piggyback implant, or by rotating the existing lens in case of toric implants. As it is a second intervention, there will be cost implications. Sometimes it may not be covered by Medicare and health insurance, and you may have to bear the cost. Laser refractive fine-tuning, LASIK, is another option to enjoy glasses-free vision. This type of surgery is, however, done by corneal refractive surgeons. If you opt to undergo this procedure, I will be happy to refer you to another colleague of mine who practices corneal refractive procedures. The cost, however, may not be rebatable by Medicare. On an average, 9 out of 10 surgeries go well. However, one needs to know that cataract surgery may have its own complications. The major risks of cataract surgery include, but are not limited to, bleeding, infection, injury to parts of the eye from anesthesia or the operation itself, pieces of the lens that drop to the back part of the eye requiring a different surgical procedure, high eye pressures, a detached retina, double vision, and a droopy eyelid. I might not be able to place in the intraocular lens that has been planned. In addition, the intraocular lenses may later need to be repositioned or replaced if the result is unfavorable. Depending upon the type of anesthesia, there are other risks as well, including cardiac and respiratory problems. Although 90% of our results have been good in my personal audit, there is no guarantee that all goes well all the time. Really, the vision may get worse. A lot depends on the preoperative status of your ocular health, which I will discuss with you during my consultation. In some cases, complication may occur weeks, months, or even years later. In this video, I have tried to provide you a general information on preoperative assessment, including measurements and scans for cataracts, the surgical procedure and the risks involved, and also the postoperative care and recovery. Please discuss with me any pertinent issues that you would like to know about while you are here for a consultation with me. Please do not feel pressurized, as cataract surgery is an elective surgery and you request for it when you feel you are ready. The costing part is very important to you. You will get my quote once you've decided for surgery, depending on what kind of surgery and implant you would like to have. Please remember, besides my bill, you will expect a bill from the hospital and your anesthetist, as cataract surgery is done in the hospital and an anesthetist will be involved during the surgical procedure. If any pathology requests are made, bills are expected as well. If you owe a private health cover, depending on the type of health fund and the type of cover, you may have gap fees. Thank you for listening.